Surgery is performed on patients for a variety of reasons. The examination and identification of the disease, the excision and removal of diseased body parts, the palliation of disease symptoms, the restoration or reconstruction of body parts or functions, and the improvement of the physical appearance cosmetically are some of these goals. Most operations are scheduled and regarded as optional. Surgical and anesthetic techniques have improved, shortening hospital stays. Many surgeries that once required multiple days of hospital care are now carried out in an outpatient or ambulatory setting. After regaining consciousness and recovering from the effects of anesthesia, the patient is released. Minimally invasive surgical techniques are now used to accomplish operations that once needed open incisions. Nursing care during the postoperative phase focuses on pain management, prevention of complications, and preparation for convalescence at home. Patient and family teaching that began preoperatively continues during the postoperative phase and prepares the patient and family to continue care after discharge to home. Because of shorter lengths of stay, patients may be discharged with more complex care requirements. During the preoperative phase, the patient will have deficit knowledge. This care plan will address deficit knowledge from a patient and interventions. Check the description below for your free care plan worksheet. This will be useful for writing down rationales provided in this video. Now let's continue with the video. The main reasons a patient will have deficit knowledge are because of the following: insufficient information about proposed surgical experience, insufficient knowledge from lack of previous surgical experiences, misinformation presented by others. As a nurse, how will you recognize deficit knowledge from the patient? Characteristics will include the following: insufficient knowledge, inaccurate follow-through of instruction, inaccurate performance on a test, inappropriate behavior. As a nurse, here are some expected outcomes we need to achieve. Patient and family members verbalize understanding of proposed surgical procedure and realistic expectations for the postoperative course. Patient and family members verbalize understanding of proposed pain management plan. Patient demonstrates the ability to cough, deep breathe, use the incentive spirometer, and perform leg exercises. Ongoing assessment. As a nurse, we will need to assess the following: assess the patient's knowledge of the proposed surgical procedure and postoperative care. The patient should be informed about the type of surgery being performed, its risks and advantages, the reason it is being done, where the surgical incision will be made, and how long recuperation will take. The patient can offer informed permission for the surgical operation on the basis of this information. The surgeon and the anesthetic care provider are two examples of other members of the interprofessional team who may have given this information to the patient. Assess the patient's previous experience with surgery. Patients' perceptions of surgery will be shaped by their prior encounters. Patients who have undergone surgery in the past may feel uneasy about anesthetic side effects and postoperative pain. They may remember longer hospital stays than the normal shorter stays experienced nowadays. Patients who have never had surgery before could generate inaccurate opinions about the intended procedure based on what they hear from relatives and friends. The provision of patient-centered care is the main focus here. Assess the patient's level of anxiety. In addition to causing physical stress, surgery can also cause psychological stress. The patient's prior surgical experiences or stories they have heard from others may be linked to preoperative anxiety. The patient's capacity to listen, understand, and learn will be impacted by anxiety. Patients may experience anxiety related to the procedure and its possible effects on their health. The patient can be afraid of the anesthetic, the discomfort, the way their body will look and function after surgery, or even losing control. The nurse must alert the surgical team if a patient exhibits significant or panic-like symptoms prior to surgery. The procedure might be delayed until the patient's anxiety levels are lower. Therapeutic interventions. Now let's go over important nursing actions to provide the patient. Explain and reinforce the surgeon's explanations regarding the proposed surgical procedure. In order to give informed consent, the patient must accurately understand the surgical procedure. The nurse may add to the surgeon's justifications. Before the patient signs a consent form or at any other point leading up to surgery, the nurse is the patient's advocate in requesting further information from the surgical team. Provide procedural information. These steps lessen the possibility of the patient suffering damage while undergoing surgery. The patient makes use of the knowledge to actively participate in delivering this care prior to surgery. This emphasizes safety and care that is patient-centered. Fluid and food restrictions, NPO, nothing by mouth, status. Intake of fluids and food is restricted before surgery to minimize the risk for pulmonary aspiration during surgery. The timing of these restrictions is based on the type of anesthesia and the time of day of the surgery. The patient needs to understand that if these restrictions are not followed, surgery may be delayed or postponed. Physical preparation. The patient may be asked to take a shower before surgery to promote general hygiene and reduce the risk for infection. Sometimes the patient will be given an antiseptic solution to use during the shower. Patients having abdominal surgery may need to follow a specific protocol for bowel preparation. This protocol may require the patient to use laxatives or enemas before surgery. Once the patient is in the holding area, the skin on the operative site may be washed again with an antiseptic solution. Excess body hair at the surgical site may be removed. If removed, it will be done by clipping. This method prevents potential sources of infection from microscopic cuts that may occur when shaving is used for hair removal. Intravenous, IV, lines. IV lines are inserted before surgery to provide fluid, electrolytes, and emergency IV access. Depending on the type of surgery, the IV lines may be inserted in peripheral veins or central veins. Procedure for anesthesia administration. The nurse needs to reinforce information provided by the anesthesia care provider. This information includes the use of pre-anesthesia medications, the type of anesthesia used during the procedure, the effects of the anesthesia on the patient's level of consciousness and level of sensation, and the postoperative effects. Marking of the surgical site. The Joint Commission has developed patient safety goals for hospital staff to mark the surgical site without ambiguity using indelible markers. This marking should take place while the patient is awake and aware. This is based on evidence-based practice. Provide sensory information. The information helps the patient anticipate sensory experiences during the surgical experience to reduce anxiety. Noise levels and conversations. Preoperative holding areas may be noisy because of the level of activity. The patient may hear conversations among members of the surgical team. The patient needs to know it is appropriate to ask for clarification of questions or comments. Cold rooms and skin solutions. Room temperatures in surgical areas tend to be cold. The patient needs to know that it is appropriate to ask for a blanket. The patient may perceive solutions used to prepare the skin before surgery as cold to the touch. Equipment and technology that may be present on awakening from anesthesia. Patients need to know about tubes, drains, dressings, monitors, or other equipment that may have been placed during surgery. This knowledge may help decrease anxiety and sensory distortion of these experiences. Early ambulation. This activity helps prevent pulmonary atelectasis, deep vein thrombosis, paralytic ileus, and other complications of immobility. The timing of ambulation depends on the type of surgical procedure and the patient's level of consciousness. Provide the patient and family with information about preventing postoperative complications. The information allows the patient to be a full partner in postoperative care to reduce the risk of harm after surgery. That's it for this video. Check the description below for your free care plan worksheet. This will help you retain information for passing exams. Good luck with your studies, future nurse.